Hello all, this is Dr. April Bice, and I wanted to take the opportunity to give you a little brief video on the importance of SOAP note documentation and also just some details and kind of general guidelines and process to follow when you are creating a detailed and expanded SOAP note. One of the reasons I decided to do this for the class was essentially because it is really important as you move through the FNP program and you move through all of the courses that you take from here through the point of graduation to really perfect a SOAP note, especially an expanded detailed SOAP note. So we've had a couple of assignments in the course that reflect on doing SOAP note type of documentation with regard to your case analysis paper, your expanded SOAP note assignment, and then also even also with your discussion and your case study discussions on the discussion board forums in the class. So some of the things that I'm noticing from the class as a whole are just in general missing detail and some lack of providing appropriate documentation for your chief complaint in your patient. So whereas you all have been perfectly successful in the class, it's something that I think will help you in moving forward with this course and then also help you move forward progressively in the FNP program with perfecting and really optimally completing a detailed SOAP note. So the first thing that I wanted to do is I'm going to bring quite a few pictures over here. I tend to use all kinds of learning when I do videos for the class, so I hope that the pictures do not distract you, but I do think that written audio and video is essential for students. So, this here detailed. So what I wanted to essentially share with you first is that a SOAP note is not a SOAP note is not a SOAP note is not a SOAP note. So what I mean by that is your subjective, objective data collection, also of course your assessment and your plan, is going to be tailored to the age and developmental level of your patient. So make sure that when you are writing your subjective and your objective information, and then also your assessment and plan, but for this video I'm going to be focusing more on subjective and objective documentation. So remember that when you are documenting what caregivers say or even what patients say, that you're doing that from an age and developmentally appropriate level. So for an example, you are not going to write the same type of review of systems for a neonate who is 6 days old with regard to complaints of pain as you would for an adolescent who is, age 11 to 17. And what I mean by that is an adolescent can tell you if they're in for a chief complaint of abdominal pain, they can say my abdomen or my belly hurts, and it's a 5 out of 10 most days of the week. It hurts in the middle, etc. But a neonate, you would document a different type of review of systems. If you're going to be focused on the GI system, you may say mom reports that infant pulls legs up to the abdomen, frequently arches the back, cries intermittently in between feeds, cries for 3 to 4 hours of time per day, etc. Additionally, you're not going to complete a review of systems the same way for someone who may have a genetic or developmental disorder as the same way that you would document a review of systems for someone who does not have a genetic or developmental disorder. Okay, so it's really important that you remember just that very simple basic component that I was just saying, is that a SOAP note is not a SOAP note is not a SOAP note. They are all different depending on the age and developmental level of your patient. All right, so let's move these out here. And I'm going to bring up kind of a little detailed Word document for you. So I've created here just a little bit of a, only focusing on your subjective and objective portion, what a review of systems and subjective and objective information would look like in a fairly appropriate and detailed SOAP note write-up. So again, for the purpose of this video, I will only be focusing on the subjective and the objective. The assessment and the plan, most of you do, very well with. I just want to make sure that I am doing all I can to enhance your learning in your health assessment course where you focused on writing SOAP notes, and then also help you to progress in this course and future courses with SOAP note writing. So when you're doing a history of present illness, you want to make sure that you're following the standard OLDCART. Standard OLDCART format. All right, so if you're not positive or you don't remember what OLDCART is, be sure to look that up. All right, and your HPI should be addressing each one of those OLDCART symptoms, or OLDCART designations. And it's important that if you don't include all of those, then you might be missing something with regard to pertinent positives and pertinent negatives to make your final diagnosis and differential list as well as your final plan. So make sure that you're focusing on every component of that OLDCART when you collect a history of present illness, which is part of your subjective information. So remember, the difference between the objective and subjective is what the patient tells you themselves. The objective is what you see with your eyes on your physical exam. Okay? Next, when you are doing a review of systems, it is essential that you are reviewing in depth and an exhaustive list of that particular system. Now, I don't expect you to review every system if it's a focused exam. Certainly, if you have a patient coming in with complaints of a rash, you're not going to review the HEENT necessarily, their neurologic system, probably not their psychological, etc. So I understand that you would tailor that to your patient's chief complaint, but it is essential that when you do tailor that to your patient's chief complaint, that in the system, within those questions, are details that are necessary. What I'm seeing a lot of repeatedly is denies rash, denies cough, denies abdominal pain, denies swelling. So you have some of the components going, but really getting a detailed, exhaustive list of pertinent positives and pertinent negatives within that system is something that you want to focus on. So why is that important? The reason that's important is because you make your diagnosis as a provider based on those pertinent positives and pertinent negatives. So, for example, if you make a diagnosis of peptic ulcer disease, but you only have 2 pertinent positives or pertinent negatives in your gastrointestinal review of systems, that's probably going to be looked at as a problem. All right, so remember that the way you make a diagnosis and a differential list is through what the patient has and what the patient does not have. Those all equal your pertinent positives and pertinent negatives, either with your physical exam or your review of systems. All right, so in this example here on this Word document, I have a lot of detail. So for example, let's just jump down to this patient's gastrointestinal review of systems. Reports diarrhea times 3 weeks, that is watery in consistency and now bloody times 2 to 3 days. Reports occasional mucus in stool the last 2 days. Reports decreased appetite times 8 to 10 days. Abdominal pain and cramping in the lower abdomen times 8 to 10 days. Denies nausea, vomiting, heartburn in quotations because that's what the patient said. Gas, flatulence, and constipation. Denies abdominal swelling or distension. See how that is quite detailed. Instead of writing denies diarrhea or denies vomiting, denies abdominal distension, you've got more information to go on so that the next provider reading your documentation and also you as you follow up can move through that review of systems, know that you're on the right track with your diagnosis and differential list, and that if the patient comes in for follow-up, somebody else following behind you can also feel like you were on the right track with your differential list and your diagnosis. Or if the patient comes back in for a different problem or their problem now is not resolved yet, that provider will need to look back on your documentation. All right, so moving right along to the physical exam component of this. Where is it at? There we go. Sorry, so there are quite a few other details in the subjective information that I put there for you. If you would like to review those, I will make sure that I attach this to the email when I send it out. When you're doing your physical exam, you want to be just as detailed as your review of systems when it is pertinent and appropriate. Okay, so you may not do this detailed of an HEENT physical exam if your patient is coming in for a chief complaint of a toe injury. I understand that, but you want to be sure that if your patient comes in for a chief complaint of runny nose and itchy eyes, you have a very detailed HEENT system. You're probably going to have a detailed respiratory system and probably cardiovascular system as well. It's important that you pick which one of these systems is important to your patient's chief complaint and subjective information when you are documenting. And many of these go together. So if you have a patient who comes in with cough and vomiting, you're going to make sure that you have got the HEENT, cardiovascular, respiratory, and gastrointestinal system reviewed and documented in your physical exam. Okay? And making sure that you're not just putting, if it's a detailed expanded SOAP note format, you're not just putting clear breath sounds, and that's all you've put. You know, there's more to normal than clear auscultation, okay? So make sure that you are putting all of those pertinent negatives and pertinent positives with what normal actually is. What does that mean to be normal in that system? All right, I think that's probably about all I wanted to go over with that paper or that document. But the last thing that I wanted to make sure that I discuss with you guys is remember, the SOAP note, your documentation as an advanced practice provider, is your protection that you have done what any other prudent provider would do in this case of seeing that patient. So, if you have not documented clearly about what it is you decided, what it is you considered, what review of systems you did, what physical exam components you assessed, then it wasn't done. And I know we've all learned this very early on in nursing school. If it's not documented, it's not done. It is even more essential as an advanced practice provider to be sure that you have that appropriate documentation. Okay? There have been times when I have been called to court as a witness and I had to justify my own documentation, and you do not want to be in a predicament where you get to a situation where you are called as a witness to justify your documentation, but you don't even understand what you wrote and you don't even understand why you diagnosed what you did. And I have seen that happen before, not with myself, but in other circumstances. So you want to make sure that you are documenting detailed enough to support why you diagnosed what you did, what you considered but didn't do, okay, what systems you reviewed because it was pertinent for that chief complaint, and what portion of a physical exam you documented exhaustively. If you don't do that and you're not putting in all of those details that are warranted in a SOAP note and documentation from an advanced practice perspective, then you aren't doing yourself justice, you aren't doing the patient justice, and you could find yourself in some legal trouble. Anyway, if you have any questions about the video that I just went over with you, please don't hesitate to ask me. Reach out via email or phone. I'm always available, and I hope you each are having a great week.